tears don't flee. It's difficult to look back and see all this, but I know that I would never know a love like this for real. Yeah, I know it's been a minute since I've seen you, love. Every time I'm on the grind, is you I'm thinking of, wondering what would have been if I stayed here. But with the current state that I'm in, guess it ain't fair to constantly be bringing up what could have been. Digging up the rubble and the sediment just ain't good for my mental health. Cause the truth is we've been through hell. I done seen it all, but you
Hello, good evening everyone.
far away from the truth, some things I've never done. You just give me what I need, you're still my number one.
Welcome to our recent edition of BioTalk. Once again, I want to deeply apologize for the lateness. I don't know, it seems as if Fridays are going to be Fridays are going to be very engaging for me. So eventually we may have to push BioTalk into another day. We are improving anyway. We are making sure that most of the programs we are having on points. We try to make it on time. We're trying to stick with the schedule that we fixed. So just bear with us. Next time we'll be hailing off. This BioTalk was fixed for 8 and this 8:45. That's 45 minutes late. So I would prefer if we just go into it immediately. So this evening we'll be speaking about Herpes Simplex, a disease that is actually commonly known as cold sore, but when I was preparing this talk, I realized we are going to actually talk a little bit into the other aspect of Herpes Simplex. That's the one that had to do with STI. We just mentioned it briefly. We will schedule another day for us to fully go into that topic. So we'll talk around Herpes Simplex, the one that occurs in the upper digestive system. That's precisely on the lips and mouth as a cold sore, and then we'll eventually move to the STI on later date. So Herpes Simplex is actually Herpes Simplex caused by Herpes Simplex virus, which we'll be referring to henceforth as HSV, Herpes Simplex virus, which is DNA virus, one of the most stable viruses that we have in the world of viruses, and the one of the viruses that has the ability to carry out what we refer to as latency. These viruses stays in the body and can be reactivated at any time. They stay in the body. They don't produce any symptoms. They don't have any pathological effects. They show no sign. They don't even bring any harmful effect on the host. But along the line, something happens and they get reactivated. So they do that. They share that future with some viruses. Even I think they share the same future with HIV. They share it under virus or Herpes virus. So we have a lot of them. So we'll be talking about latency later. But this is a virus that has to be latency. They stay in the body. Once you are infected, it's likely you are infected for life and can be reactivated if the immune system is down. So, the introduction we have here, we said herpes simplex is an extremely widespread disease with many symptoms, and of course, it's a widespread disease. If you look at the image beside that introduction, you see the most commonest signs and symptoms of herpes simplex, and it's the places on the body that they usually infect the most, that is and commonly known is in the mouth and throat, where they cause what we refer to as cold sore or fever blisters. In fact, it's the blisters that are the most commonly seen whenever somebody is said to be having, when you say you are going to have malaria, you are going to see cold sore in your mouth and you think it's cold sore. It's not you think it's malaria. It's not actually malaria. They're actually blisters that are filled with this virus. Of course, the virus is not the disease. Cold sore itself is not significant in terms of virulence, but for babies and for people whose immune system are immunocompromised, that's a big issue for them. So let's discuss cold sore for now. We'll link it later with the other aspect of herpes simplex virus. So cold sore is usually caused by, there are two serotypes of herpes simplex virus. We have HSV1, HSV2. Cold sore is usually caused by HSV1, and the signs and symptoms include fever. You have throat pain, usually sore throat. Then we have this ulceration of the mouth and throat, which is shown there as fever blisters, and that's the initial infection when you first have it. So if it undergoes latency and the virus now, the disease now decides, or the virus reactivates itself, this reactivation leads to recurrence of disease, and it presents a different types of symptoms and signs entirely. And these signs and symptoms of the recurrence include itching, tingling, and we have pain in the lips. Of course, that's where that reactivation usually comes up. Most of those of us who have had blisters in the mouth realize that it always comes periodically. That's the period of reactivation or reoccurrence. Then once this pain comes, then it's followed by blisters that breaks out into a painful sore, and then within 7 to 10 days it gets healed up. One terrible sign of HSV is hepatic whitlow. I included it there. Most of us are very conversant with what whitlow is, and one of the major causative agents of whitlow is HSV. I just put it there, but we're going to talk about it very much later. In the epithelium, destroying the cells. Usually, of course, the place of primary infection is the mouth and lips. So once those areas are infected, they multiply there, they destroy the cells there, and then they break out. So the immune system, of course, limits the infection. Like I said, the virus and its infection, especially the cold sore, are not that serious. They are not that significant, and that's because they have this relationship with the immune system, where the immune system is able to limit their activities. So when the immune system is actually very active, HSV withdraws. They enter into latency stage, waiting for when the immune system is compromised, when it's low. So if you have noticed, one of the reasons why this cold sore usually breaks out during the period you are likely going to have malaria is because malaria actually does a lot of damages to the immune system whenever you are having it. It brings down, it's associated with immunocompromisity in some stages. So once your body is undergoing that kind of stress or immunocompromisity, it's very easy for HSV to reactivate, and then you'll be seeing the signs on your lips and you think you're having malaria. So most of us have been infected with HSV. In fact, it's actually one of the most widespread, if you remember the introduction, we call it extremely widespread disease. And most people have been infected during their childhood. And of course, the virus is transmitted by close contact. The fluid that comes out of that blister whenever somebody is infected contains millions of virions, contain millions of the infectious virus. So you come in close contact with, there may be the person uses his hand to touch the blisters, and then you shake the hand of the person, or the person is you just get in touch in any way, then there's highly possibility of the person being infected. And if you are if you are the kisser, if you kiss this kind of person at this moment, of course you are going to get infected. So despite the fact that human contact is one of the primary way of transmitting this virus, we also have transmission through inanimate objects, which we refer to as fomites. So if for instance I touch my blisters and I use that hand in holding a cup or in opening a door or in touching anything, and somebody else touch the same door handle, hold the same cup, of course you are going to get transmission is going to happen. Of course, infection is limited by a lot of things, but that's one of the ways in which the virus is transmitted. And look at this information: the saliva of asymptomatic people can be infectious. Even if you don't have the symptoms yet, the incubation period is usually 2 to 10 days. So, and if you remember one of our talks, we've already defined incubation period as the period within the time that the person is infected and the period within and the period at which you're showing the signs and symptoms. So even when you are not symptomatic yet, within that 2 to 10 day period, you can still transmit the virus, and this actually poses a risk to dentists and healthcare workers. Dentists, if they don't see the cold sore in your mouth, on your lips, they may assume that you are not infectious at that moment. Yeah, they would think that, oh, this person is actually safe to get in contact with, but the person is not safe. So asymptomatic people, they are actually a serious health risk to dentists and healthcare workers. And of course, as you can see, we said that HSV can infect any body type, any body tissue, any type of tissue in the body. Of course, it infects the fingers, hepatic whitlow. It can cause keratoconjunctivitis in the eyes, and of course it can lead to viral encephalitis in the brain, amongst many other. We're going to talk about the manifestations before this talk is over. And okay, so if you look at it, the manifestation I was talking about, if one is not very careful, most of the time HSV can be mistaken for varicella zoster, that's chickenpox infection. So you may actually need to be very observant to know that they are not the same. And on the skin, HSV cause fluid skin blisters, like the one in the mouth or the one shown beside the image that beside this particular subtopic that I'm talking about right now. And of course, the primary infections occurs in the mouth and lips, like I said, and the reactivated infection usually presents as a cold sore on the lips. Apart from this, so I'm generally talking about the HSV1 and the HSV2 now, but eventually we'll talk more about HSV2. HSV2 also causes vesicle and shallow ulcer in the genitals. Encephalitis can also occur. Encephalitis is the inflammation of the membrane covering the brain cells, the brain tissues. So that's one of the most dangerous infections to ever have. So once that membrane is inflamed, there's a lot of issues. It can also cause meningitis, especially HSV type 2. Then, like I said, HSV1 can cause conjunctivitis, keratoconjunctivitis, which can lead to even blindness. And it can cause pneumonitis in immunocompromised patients, those who are having maybe who are under antibiotics therapy, or who are having transplantation, HIV positive people generally have who are in a prolonged immunocompromised state. Once your immunity cannot actually defend your body against external disease, that's the definition of immunocompromisity. So then we also have neonatal herpes, which is actually very dangerous. Most babies usually acquire HSV infection from the mother genital tracts when they are being born. So, and they are at the risk of developing severe or fatal HSV infection because their immune system is not yet perfect. Once a baby has contract HSV, the best thing to do is to get expert specialists to monitor the baby or to treat the baby, or else it's going to prove fatal to the baby. So what are the treatments and prevention? Of course, the prevention is is to limit interaction with the fluid of that particular blister, of those particular blisters. Whenever you see it on the body, on the lips of, that's not the time to do TLC. Don't need to do TLC at that moment. You don't need to say, I love this person. Once you see the blisters, please avoid getting close contact with the person. Most people usually have a way of covering it up using some maybe cotton wool and I don't know, so that the fluid that is heavily infused with the virus will not get in touch with people. So I think that's the preventive measure. Another way to prevent it is to limit one's exposure to sunlight, because sunlight usually triggers the reactivation. So if you know that you've had the infection before, using sunscreen is actually very effective in preventing the disease. For the treatment, the medications that is usually being used is cyclover and penciclover. They target the HSV DNA polymerase, and they are used in treating severe cases of the disease. The acyclovir comes in either in oral form, the oral tablet, and in cream, in gel form, that you can use as cream. So most of the time, the blisters on the skin are actually being treated using the cream. When it's an STI, it's you use the oral tablet. though most of the time both are actually to be used in some infections, both the oral drugs and then the skin, the superficial drugs which is used on the skin. So please, once treatment if you want to treat HSV infection, please contact your physician, or you can get across to me or microbiotics. We actually have experts that can actually give you hints and directions and recommendations about the treatment. So of course, differential and laboratory diagnosis, like I said, HSV can be mistaken for VZV infection. That's varicella zoster chickenpox. They have almost the same manifestations. So, but this is simply the difference. The lesions being produced by HSV are usually at the same stage of development. Once you see them, you know that okay, the lesions look the same throughout. They look the same throughout, but in chickenpox, it starts at a particular place. The lesions are more at a particular part of the body than at other parts of the body when the infection starts. So it's most of the time when somebody has HSV, they can think it's chickenpox, but it's not actually chickenpox. So, but if you actually want to know, especially when it comes to the STI, we're going to talk about the STI very much later, because it's actually one of the most dangerous form of that's what they call herpes that occurs around the genital. So if it's just the cold sore usually resolve itself within some days, except in neonates. But for HSV2 that causes genital herpes, it's actually dangerous. We're going to actually talk about that maybe in the next lecture. Yeah, I think the next talk should be about genital herpes. We'll do justice to that. So the way it's been diagnosed, you can use a viral culture, which is not actually ideal because it takes time. You can also use PCR, which is what microbiotics actually provides. We do PCR, which will take just within 3 hours you've had your results. The antibody test, the serological test, are not actually reliable because of the difference, the similarity in the results that comes when you test for HSV1 and HSV2. So they don't really work. It doesn't really. So it's not actually a good diagnostic tool for HSV. That's antibody or serological test. So the standard test is actually a polymerase chain reaction PCR, and we definitely provide that. So in conclusion and recommendation, we of course at microbiotics we provide good diagnostic services for Herpes Simplex virus infection, as we do for many other viral infections. In fact, in the next few months, we are rolling out a lot of programs for diagnosis of viral infections. And don't forget that once somebody is immunocompromised, once you know that the immunity of this person is faulty, I think I should actually note it down. We're going to have to talk about immunocompromisity as a topic, so that people will actually know what it means to be immunocompromised. So, because there's some signs, some telltale signs and factors that contribute to being immunocompromised. So we have to do that as soon as possible. In our next, I've not said it now. In one of our next Health BioTalk. So if somebody is immunocompromised, any rashes on his or her body must be taken seriously. Rashes, because rashes don't usually happen rashes are usually being controlled in people with good immune system. But if there's a continuous rash and you know that this person is immunocompromised on the body, please, it has to be taken serious. And we have of course we have facility and the personnel to carry out diagnostic tests to detect this virus. And we also have people that can actually give you information, like myself and others as well. So if you have questions, if you have inquiries to make about this disease and other viral diseases as well, please get in touch. We'll try and give you the best advice and information that you can have around. So that'll be all for this evening. Thank you for attending. I hope we've been able to gain one or two things. I don't want to, of course, it's not supposed to be long. We're supposed to have the normal regular time for Health BioTalk is just 30 minutes. So any questions that you have, you can definitely post at the comment section. Let's have an interactive talk about this so that we will gain much more knowledge. So have a lovely night and take care of your health, and don't forget that health is wealth as well. Bye.
Stunning body, the reason I can't even keep my little man in check. She about Bobby X and I sign little check. Guess me gonna take her home cause she a full spec. Julie, plenty things where you did do me. It be like say man don't they lose it. Body strong and the mind is real, and see that body don't judge me, I can't hide it. Oh my Julie, your vibes truly. If you like say man don't they lose it. The way you park is in a hold it. In a hold it. I love the way the car jiggle, baby, when you walk. Keep me motivated, I should put a little work. I'm making you my lady cause the body done the joke. See, I hope I hit the target, baby, not the woodwork. This is real talk. So you give a brother man goosebump. Never ever lacking like you're too dope. Always hold you down, never screw up. Yeah, she a delight to my soul and she making me lust. Body damn perfect. Stunning body, the reason I can even keep my little man in check. She about Bobby S, so I sign little check. Yes, me gonna take her home cause she a full spec.